Uh, I was, so guys, do you hear me?
Yes.
Okay, as I told you, we're going to start now. Each one has 15 minutes. I'm going to start with the suggested breakout rooms, okay? So the first one would be Bernardo Cuba. Please, at the end of the class, I want you to join back, uh, all of you, okay? So we can have the poll. We have a daily poll, um, a survey, right? So at the end of the class, you're going to please join back this meeting to get that done, okay? So we're going to start with Bernardo here. As I told you, then it's Burgo is going to be the last one because she has, well, she missed the last practice class, and now she has 30 minutes corresponding to this one and the last practice class. Okay, so let's get started with Bernardo. Okay, I'm going to send you invitations to join this group just with me. Okay, so let's start with Bernardo. Okay, so Bernardo, do you hear me? Bernardo, are you there?
Yes, hi, doctor.
Hey, how are you doing?
Fine, thanks.
Okay, great. So there is only the two of us right now, okay?
Okay.
So I'm going to start sharing my screen and with this slides. So you can see my screen, right?
Yes.
Okay. So let's get started. So, well, this is all mixed up, okay? So we have a lot of specialties that we already talked about yesterday, right? You
Mm.
remember. Um, so we're going to start. We have 15 minutes from now. Okay. So first question, could you tell me the name of the specialist that is related to this specialty right here?
Yes, is pneumologist.
Okay, yes, and you used correctly the ist suffix, right? However, let me give you a piece of an advice. It's not pneumology, okay? It's pneumology, okay? Could you repeat it?
Pneumology.
Okay, so the specialist would be
Pneumologist.
great. You can see it right there. So, could you tell me what a pneumologist does?
He's a specialist about the low and higher uh, respiratory device.
Okay, it would be airways, right?
Airway. Yeah.
We already talked about the upper and the lower airways, right? So yes. What else? I mean, the airways is one thing, right? And the main organ about pneumology would be
Sorry, I don't understand.
okay. So we have airways, right?
Yeah.
Uh, they are like tubes, right? From the nose to, well, the upper airways would be everything that is above the larynx, right? So that is the upper, well, those are the upper airways. And the lower airways are the trachea. What else?
uh, bronchiolos,
Okay, bronchi, yes. So
bronchi.
they are like low, right? They're down below. And they are just airways, as its own name is telling us. So what else would it be besides airways? We have our these
The lung.
organs. Yes, great. The lungs. So that's what this specialty is all about, right? Diseases related to upper, not so much upper, but yes, lower airways and lung diseases, right? Could you tell me? Could you tell me a disease that you might know from the pneumology field?
Tubercu tuberculosis.
Okay, great. Tuberculosis. Okay, what could you tell me about it? Here we have a chart that would be useful for us. What symptoms and signs could we find in tuberculosis?
Uh, cough, high temperatures, and
Okay, so let's write it down, okay? It would be, what did you tell me? Cough,
cough.
right? Okay, it's pronounced like this. It's written like this. You pronounce it cough, okay? Like an F. It's cough. Could you repeat it, please?
Cough.
Cough. Okay, what else?
High temperatures.
Okay, we would call that a fever. Fever. Okay, you're seeing it, right? On the screen. Okay, what else would we find in as signs or symptoms of tuberculosis?
Sorry, what?
What else would we find, or what else would our patient that has tuberculosis tell us that this person has? I mean, the symptoms
Um,
besides the cough and fever, yes, which are fine, yes. What else would this person have?
uh, how how can I say it? Pérdida de fuerza.
Okay, that would be weakness. Okay, in Spanish would be debilidad. That is what you refer to, right?
Yes.
Okay, weakness. Any other thing? I mean, yes, cough, fever. Is there any association with the time of the day that we would relate fever?
Yes, is most in the afternoon.
Okay, yes, great. What else would we find? Symptoms and signs about tuberculosis. When a person goes thinner, loses weight, right?
Yes.
And is that associated with tuberculosis?
Yes.
How would you describe that?
Uh, I don't know.
Okay, don't worry. It would be like this. Uh, weight loss. Okay. Uh, Loss means pérdida. Okay. And weight is peso. Okay. So this would be it. Weight loss. Okay. Is there anything else you would like to add?
Yes, it's all.
Okay. So what about physical examination? What would you find in a patient that you are suspecting about tuberculosis?
Uh, ¿Cómo se diría silivancia?
Okay, it's like this, okay? We zinc, okay? That you would find that on the physical examination when you're listening to the lungs, right?
Yes.
Okay, Is there anything else you would find?
Mm, mm, I think no, but I don't remember many symptoms or signs.
Okay, but we're talking about physical examination here. So this person would have anything else?
Uh,
On physical examination. This person would be thin, right? Do you know the meaning of thin?
Delgado.
Yes, yes. I've seen a lot of patients with this infectious disease, right? And they are all very thin. I mean, there are just a few people with a normal range of weight. However, most of them are really thin. I had this rotation on infectology, infectious disease department. I saw a lot of people with HIV and tuberculosis. Here in Bolivia, there's a lot of people with that, right?
Hmm.
So let's go on. What you would ask for as a complementary study?
Uh, Esputo, how can I
Okay,
say?
okay, it will be this way, okay? Sputum. It resembles Spanish, the word in Spanish. Okay, so what else?
Uh, Alicia test.
Elisa, right?
Yeah.
This enzyme linked assay. That one, right?
Yeah.
Okay. What else? Well, these are lab tests, right? So, anything else when we're talking about the lab tests?
One more, but I don't remember the name. Um, G something. I don't remember. Sorry.
Don't worry. Well, I don't. Well, I don't get it. Okay. Anything else besides lab studies? Maybe some.
Ah, Ray X
Okay,
of
it would
thorax.
be this way. X-ray. Okay. So this is an X-ray, right? What projection would you ask for? We already
Uh,
talked about directions.
PA.
Sorry.
Uh, a PA.
Yes. What does PA stand for? Do you remember?
Uh, how the rays going through the person, or how the person have to be.
The X-ray beams, right? They go from the posterior to the anterior, right? So the direction is posterior,
To
anterior. This is like what we call PA X-ray, right? And what part of the body would you ask for? Because here we're just talking about the projection, right? So let's talk about the part of the body we want the X-ray.
the thorax.
Okay, so we have and from the chest, okay, chest or
Ah,
thorax. Yes, that would be even better. What you said.
okay.
Yes. Okay, great. How do you treat a person with this diagnosis?
uh, with the schema. How can I say schema?
Okay, it would be like this. I'm going to write it down here. Okay, and it would be shim. Okay, that is
Okay.
the main word. Yes, we have actually, how many of them do you know?
Uh, I remember we have one for child, one for the first persons who have the first infection, one
Yes.
and another to the ¿cómo que dejó el tratamiento,
Okay, stopped taking the treatment, right?
treatment, stop the treatment,
Yes.
and I think it's all, and and the persons who have uh, sorry, Doc, I am remembered of all that, and
Yeah, don't worry. They are basically, well, I remember there were three basic ones, right? So, yes, do you remember what Gauss complex is? I'm going to write it down here. Did you ever read this, Gauss complex?
no.
Okay, so you find this is, well, the Gauss complex is finding when you have your X-ray, when you have your thorax X-ray. There's like this is a sign, okay? So there's well, there's you know a weight, right? What you lift in a gym, a weight.
Sorry, I don't hear the dots.
Okay, don't worry.
Yeah.
Okay, okay. When you go to the gym, you lift weights, right? This one, this word right here, weight is pesa, right? And when there you got your X-ray with you from a patient with this disease, there's like uh, one side of the weight would be a ganglion, okay? The other side of the weight would be uh, the parenchyma of the lung, which is affected, which is also seen as a round part. And the last, sorry, okay, and the middle part is lymphatic vessel. Okay, so tomorrow you're going to tell me what a Gons complex is. Okay.
Okay.
Okay, you can read it. And well, we got our 15 minutes. And remember to join back at the end of the class, please, so we can have our poll. Okay?
Doctor, about
Yes.
this, I have a test in half
Oh,
hour. Maybe
okay. 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 You don't worry about it. You go ahead. That is important. It's understandable that you cannot because you have some other activities. So don't worry. I'll see you tomorrow then. Okay.
uh, uh, tomorrow también voy a tener un examen, Doc.
Tomorrow also. Okay. You can. Could you please tell our coordinator about it?
Okay.
Okay. So I hope I'll see you on Thursday. Okay.
Yeah.
Okay.
Thanks.
So take care and I'll see you on Thursday.
Thanks. Bye, Doc.
Okay. Bye. Brisa, are you there? Okay, Brisa, you're here, right?
Yes, I am.
Okay, let's close this one. Um, okay, so well, as we were talking yesterday, there's a lot of specialties, right? And we had a lot of them. We practiced a lot of pronunciation about the specialist and the specialty, right? So what you have here, well, it's these all these specialties are mixed up, okay, in my slides. So you got the cardiology specialty. Could you please tell me the Could you please tell me the name of the specialist related to this field?
Uh, the cardiologist.
Yes, the cardiologist. So, could you tell me what the cardiologist does?
Mm, okay. He sees people with cardiac problems.
Okay, not only heart problems, right? And they're also from vessels, right?
Yeah.
Okay, so could you tell me a disease related to this specialty?
Mm, could be hypertension.
Okay, hypertension. Okay, I'm going to write it down here. Be hypertension, right? So, well, you got me. Well, do you know any symptoms that would be related to hypertension or signs?
Um, a sentence.
No, just give me loose words like the symptoms or signs that a person with hypertension might have.
They will feel tired. They cannot walk a long uh, distance.
Okay, could be. What would you call that? What would you call that symptom?
Uh, fat, fatigue.
Okay, like this, right?
Yeah,
Okay. What else would you find in a person with this diagnosis?
it could be chest pain.
Well, okay, let's write it down. Uh, like this, right?
Mhm.
Why would this person have chest pain?
Because the blood pressure is too high, I think.
Okay. Any other symptom or sign related to hypertension?
Mm, the rhythm of the heart is irregular.
You mean an arrhythmia?
Yeah.
In a long term, it could be, right? Yeah. Do you know how rhythm is written?
No.
Okay,
A rhythm. I think it's RHYTH.
like this.
MS. Yeah.
Okay. Actually, there's it's a little different. It's like this, okay?
Okay.
So it would be, sorry. Arrhythmia, okay? So this would be the word, okay? Related to rhythm, and the pronunciation is rhythm, okay? Any other thing about signs and symptoms that this person might have?
Nosebleeds.
Okay, bleeding nose. Yes, that would be more accurate than the other ones, okay? Any other?
Headaches too.
Okay, like this, right?
Mhm.
Okay, do you know what pressure is the blood pressure? I mean, how high would the blood pressure would have to be to produce a headache?
More than 140 and 40.
Which one? We have the systolic and diastolic pressures, right? Which one is more related to headaches? Do you know that?
This diastolic.
This is the diastolic.
The diastolic.
Yes, it would be this one, right? Diastolic. So when the diastolic pressure, we are writing it down like DP, right? Diastolic pressure is higher than 110. It could be related to headaches. Okay.
Okay.
Okay, so what about physical examination? What would you find in physical examination in a patient with hypertension?
The high pressure.
Yes, high blood pressure. Okay, anything else?
Mm, well, maybe the sodium is high too.
The sodium?
Yeah.
Okay, but we're talking about the physical examination first. He would be right here in complementary studies, the laboratory, okay? So
Oh,
first here, physical examination.
mm, I think that's the main thing that you can find.
Yes, that would be the first. But well, the most important actually, yes. But if you have this person who has had this disease for a very long time, what would you have to look for?
Uh, his pulse.
Pulse?
Pulse.
Pulse. Okay, so what would you tell me about the pulse in a patient with hypertension? I mean, in a long term, right? Because first the person is mostly normal, right? You wouldn't have that much variation from the normal ranges of pulse. What would, how would pulse vary in a patient with hypertension in a long term?
I don't know.
Okay, in a long term, hypertension produces heart failure. Okay, and
Mhm.
when we're talking about heart failure, there's this one. Have you ever read about this?
Uh,
This is the main, well, this is the name of a certain variation of the pulse. Have you ever read about it?
I don't think so.
Okay, when the heart is already failing, that is what a heart failure is. Okay, so it does not the the heart does not pump blood in a correct manner. So it's like when uh, when the heart has one regular or normal beat, it goes like this. Okay, like a mountain.
Hmm?
And the next one is the next beat of the heart is really weak. Okay, so the pulse
Hmm?
is low. That is what pulses alternance is. One regular pulse and a low pulse. High pulse or normal pulse and lower pulse. Higher and lower pulse. That is pulses alternance. Okay, that we could find that in a patient with hypertension in the long term. Anything else about physical examination?
I don't think so because the main thing is that you have to ask about his clinic history.
Okay, history. Have you ever read about the wrist, ankle, oh, sorry, ankle index? This one, wrist, ankle index.
Um, no.
Okay, you're going to tell me tomorrow, okay? This, I think, if I'm not mistaken, this has another name, which is Yao index. Okay, so you're going to investigate a little bit about um, this index, okay?
Okay.
It is related to hypertension. It is quite important and interesting. Okay, so let's go on to complementary tests. What would you ask as a doctor that you're going to be? What would you ask for in a patient with hypertension?
Now, first of all, if it's a woman, for a pregnancy test,
Pregnancy test. Okay, what else?
uh, the urine protein,
Great. That is urine test. Okay. What else?
um, we have to check the glucose too.
Great. Glucose. Anything else?
The cholesterol,
Great. Yes. It's written this way. Okay. With CH, cholesterol. Anything else?
an electrocardiogram.
ECG, right? Yes. Great. Um, anything else you would like to add?
Mm, the sodium will be, we have,
Yes. Okay. So we also asked for electrolytes. Okay. Electrolytes. That is how this is written. Okay. So um, you told me about sodium, right?
hmm?
It could be, or yes. Do you know what patient? How do they call it? It's uh, I'm going to write it down here. Okay, it's high sodium sensitivity. Do you know what high sodium sensitivity is?
No.
Okay, I'm going to tell you because I already gave you homework with the wrist ankle index. Okay, so a person is considered sensitive to sodium when diastolic, the systolic pressure increases 10 millimeters. Sorry. So you measure a person's blood pressure, right? And then you give your patient middle range load of sodium. And if after this person takes the sodium, increases the systolic pressure 10 millimeters, this person is sensible to sodium. Okay.
Mm, okay.
Okay, that's also useful for you. That's going to be useful. So anything else you would like to add about hypertension?
Mm, no,
What organs does this disease affect in a long term?
the kidneys,
Yes.
um, the baby too, when it's a pregnant woman.
Okay, yes. Pregnant.
Um,
That is called pregnancy related hypertension. Okay. We
mhm.
are going to really talk about it when we have the chance. So anything else?
No.
Kidneys, also the heart, right? It,
Yeah.
as I told you, it in a long term, it takes us to heart failure. And one more organ,
Mm, I don't know.
hypertensive retinopathy.
Oh, eyes.
Uh, Actually, just retina, right? Do you know the scale? There's a scale in which you can use to, well, when you have a patient with hypertension, the first you, of course, as you told me, you have to measure the blood pressure, right? And then you should look for any signs of damage in some other organs. How do we do that? With well, when we check the retina, okay? If there is some pathological sign of hypertensive retinopathy, that would lead us to uh, hypertensive nephropathy, okay? We have this
Mhm.
person with hypertension, you have to check the retina, and if there are pathological findings, you suppose that there is damage in this patient's kidneys. Okay.
Mhm.
Okay. So we already completed our 15 minutes. And remember to join back when we are done. At the end of the class, we are going to have the poll or the survey. Okay.
Okay, at what time, more or less?
I don't know. I don't know if anybody else joined. Uh, we'll have to calculate. Well, I think it would be around 2 hours, more or less. Okay.
Okay.
Okay. However, I'm going to write it down in the chat so everybody joins. Okay. So, see you then. Thank you.
Okay, thank you.
Bye. Marcela Guzman, are you here? Hello, Marcela. How are you doing?
Hi, I'm fine. You?
I'm fine, thanks. Thanks for asking. So, as we were talking about yesterday, we had a lot of specialties that we talked about, right? And well, there is, here we have slides. Okay, let me do this. You can see my screen, right?
Yes.
Okay, so you got, I mean, I wrote down some specialties and they're all mixed up. There's no singular order for each one. So you got hematology, okay?
Mhm.
So could you tell me what the specialist related to hematology is called?
Well, I I think it's more like when for example I have anemia, I
Yes.
usually need to go to hematologist.
Okay, well, you're right. It's a hematologist. Okay, notice the pronunciation. It's hematologist. Okay,
Hematologist.
yes, hematologist.
Yeah.
Okay, so could you tell me what a hematologist does? You are Marcela Guzman, right?
Yes.
Okay, I'm going to write down your name. Okay, so so tell me what a hematologist does, please.
Mm, Well, I think he's like an internal doctor. Like he mostly see childs, for example, or any disorder that someone has. As I told you before, some disorder in disorder or something like that.
Yes, great. So could you tell me any disease related to hematology?
Mm, Leukemia
Okay,
could be one.
leukemia.
Leukemia.
Leukemia, yes, that is the pronunciation. Okay, it's kind of difficult, however, leukemia, right? Okay, let's talk about leukemia. What symptoms and signs would this person have if a patient you're treating has this diagnosis, of course?
For example, first of all, it will be like the weight of loss of
Okay,
weight.
it would
Wait,
be,
I have a doubt right there. It's weight loss or loss of weight.
let me tell you, both would be correct. However,
Uh,
we mostly use weight loss,
weight
like
loss.
this, right?
Okay.
Okay. Anything else you would relate to this disease?
Mm, some headaches, or also it could this person could have like a pain on joints and bones.
Yes, great. Yes. Um, so we're going to write joint and bones related pain, right? Okay. Anything else? I mean, besides, well, we have this in leukemia, the white blood cells. It's like they are a lot of them, right? And they
Mhm.
inhibit the growth of the other cells. So what else would this person have?
Maybe one of the most important symptoms, it could be like this person it will bleed easily, or have any breast.
Great, bleeding. Yes,
Mhm.
gum bleeding, nose bleeding. Even let me tell you, I already told you I was a resident of this specialty. I saw some patients bleed from the eyes and bleed from the ears. They got easily. I remember I told you the. I I think it was on the first day. I told
Mhm.
you bruising.
Mhm.
Do you remember what this is?
It's can I say in Spanish?
Okay,
Son moretones.
great. Yes. And I also told you an expression, right? Um,
I forgot about that.
okay, don't worry about it. It's like I'm black and blue, right?
Oh, yes.
Black and blue. Yes. Anything else about symptoms or signs related to this disease?
And vomits.
More or less. Okay, let's. Is there another word or expression to talk about vomiting? This person would. There's a phrasal verb. We also talked about it.
Yes. And I don't remember that one.
You forgot it? Okay.
Yes.
I'm giving you little hints. You're seeing the screen, right? Okay, I think that is enough. That's a huge clue.
Throw out? No.
Throw, yes. Oh, sorry. Uh, throw up, right?
Up.
So this throw up means to vomit. It's a phrasal verb. Okay, so we're going to write down to vomit and to throw up. It could, well, it's not that related, but it could happen, yes. Anything else you would like to add here?
I think because of the problem is it's like a blood cancer. A blood cancer. Maybe this person will have currently infections.
Great. Yes, this there's a lot of white blood cells, right? However, they are not functional, and yes, they do get infected very easily, right? So infections, yes. And right after chemotherapy, also, they get more immune compromised. So infections are really the most usual complication in these patients, right? They would also, these cells would also diminish the counting of red blood cells. So this person would have
A low count of cells.
uh, these cells that are not normal, right? When there's leukemia, inhibit the growth of platelets, which leads to bleeding, right? And what about red blood cells?
I don't get you at all.
You didn't get the question?
No.
Okay, so can I say it in Spanish?
Please.
Okay, cuando las células tumorales, que son las células blancas, ¿no es cierto? Incrementan en número, inhiben la producción de las otras series celulares. En el caso de plaquetas, como hay disminución de plaquetas, tenemos sangrado. ¿Y qué pasa si es que hay disminución de glóbulos rojos?
No va a haber factor de coagulación.
Related to red blood cells, this person has anemic syndrome.
Oh, I forget about what is this? It won't have like well, the red cells contains oxygen, right?
Oxygen,
So
yes.
there is something that has that keeps the oxygen in that cells, but I forgot about that one. I think it's at the point you're trying to go on, but what is this? I forgot about these ones.
Okay, you can tell me tomorrow, okay? That is going to, each one of your classmates, I asked them something, and if they didn't answer, they are supposed to tell me tomorrow. So you have until tomorrow to remember, okay? Okay, so what would you find at the physical examination in this patient?
Well, maybe I will find like for example, the bruises that are the most important. So can I mute my microphone a little bit because there is a little bit of noise over there, or it doesn't matter.
Okay.
Okay. Okay, I think it's a little bit lower now.
Okay, don't worry
So,
about it. Yes,
okay,
you can go on.
maybe it also can, the person will be like, it will show up if like he is or she is like how is this word like uh, he will the person will be will look easily like he is or she is ill, has an ill because it's losing weight, or also it's like, I don't know, it will look out like sick. I don't know if you understand me.
Yes, yes, I get it. This person would, first of all, would be thin, right?
Yeah.
Thin. Do you know the meaning of thin, right?
Yes, it's when someone it's like looking a little bit like um with less mass.
Okay, yes, like this person has just lost some weight and looks fragile or something like that, right?
Mhm,
And has a lower weight than he or she should have, right? Should be.
mhm.
Okay, what else?
Um, I really don't know what something else I can.
Okay, so what about the complementary studies? What would, as a doctor, what would you ask for in this patient?
Yeah, well, I think first of all, a blood test. Blood test.
Okay, blood test. And what would you find in this case?
Well, because it's blood cancer, I will find like uh, uh, the count of blood cells, it will be lower than the normal ones.
All series or just, I mean, yes, platelets and red blood cells would be low. However, what about white blood cells?
Mm. So this one, I haven't get a think about that.
You didn't read about this. Okay. Here, it is actually, well, the word leukemia, leuka means white, right? And emia means blood. So literally, it would mean white blood. Okay. So uh, there's an increased count of white blood cells, actually. Okay.
So
Yes, I'm listening.
okay, so it will be like a less count of red cells and among well, it will increase the count of white cells.
Yes.
Okay.
Okay. It would have a higher count. There's a lot of white blood cells. That is why this is called leukemia. Leuka means
Mhm.
white, and emia means blood, right? So
Yes.
in a peripheral blood sample, we would find a higher number of white blood cells and a lower count of platelets and red blood cells. Okay.
Mhm.
Do you know this term, smear?
Mm, no.
Okay. And smear is what I'm going to say it in Spanish for you to understand. Okay. Uh, es un, sorry. Okay. So an smear is when you take a blood sample a peripheral blood sample, and you put like when you're seeing something under the microscope, you have these objects like glasses, right? And well, in Spanish would be frotis de sangre periférica. You might have heard of that, right?
Yes.
That is a smear, okay? A smear. So we would also ask for a smear of peripheral blood. Okay, anything else?
Maybe a spinal tap.
Sorry?
As I don't know if the pronunciation will be like spinal or spinal, but like to make an account of saints, but so sorry, but or the fluid, but from the spinal cord.
Great. This one, right? Spinal fluid. Sorry, spinal fluid. Great.
Yeah.
Okay, great. We would also find a higher count of white blood cells right there. Okay, okay. So we got our 15 minutes. So Marcela, let me remind you that you have to join back when we finish with all your classmates because we have the poll or the survey. Okay?
Okay. Will you notify us to join again, or what? Or how we will know that it's time?
Well, you can have your cell phone next to you, right? I'm going to write down, well, I'm going to send a message at the WhatsApp group, okay?
Okay.
Okay, so
Well,
thank you. I'll see you later.
well, see you later.
Okay, bye. Mariana Sanginez, are you here? Okay, Mariana, how are you doing?
Hello and good evening. Yes,
How? Okay, great. So remember yesterday we were talking about some stuff related to the medical field, right? And we talked about some specialties yesterday, and well, I had some specialties here in my slides, and well, they're all mixed up, okay? So you got your neurology. I mean, it's all mixed up. It's all luck. Okay, so you got neurology. So could you tell me the name of the specialist related to this field?
Neurologist.
Yes, great. What does this specialist do?
Well, it examines all that has to come to uh, central system.
Central nervous system. Okay.
Central nervous system. Okay.
Okay, so I'm going to write down your name. You're Mariana, right?
Yeah.
Mariana. The last letter in your last name is with an S, right? Okay.
Yeah.
Okay. So could you tell me a little bit about any disease related to neurology that you might remember?
Before before that, I wanted to tell about something that um, actually I am not a med student. I'm part
Okay.
of medical staff, I'm currently studying physical therapy.
Okay.
So I don't have that many knowledge about diseases yet.
Okay.
I'm in my second year.
Okay, great. So, well, however, you as a physical therapist are going to see a lot of neurologic patients, right?
Yeah, I
Uh,
just wanted to clarify it before
okay, don't worry
because
about it. Okay,
sometimes I don't understand, or I am a little bit slower in understanding than the
no,
others maybe, and that's
no,
why.
don't say that. I mean, you have your career. I mean, your career is great because there's a lot of utilities for a physical therapist. They not only work with neurologic patients, they give respiratory physical therapy, right? Patients who have like some secretions they cannot get rid of. You give physical therapy to that kind of patients, right? To help
Mm,
them get rid of that secretion.
yes, I know. um, well, talking about a disease, that's why yesterday I made that example, multiple sclerosis.
Yeah, well, multiple sclerosis. Yeah, it's kind of that is a really interesting disease. Did you read anything about it?
Um, just about I don't know how to say physiopathology a little bit.
That is the most difficult part, and you're diminishing yourself. I mean, come on, yeah, that is great. What did you read about the pathophysiology?
Well, that our immune system becomes against us,
Yes,
and it goes through the membranes of the brain and goes inside. And I don't know how to say it in English, los linfocitos B,
yeah,
cause I don't know how to say inflammation,
yeah, inflammation. Yeah,
inflammation in our neurons in a part that of an axon that is well
yeah.
in the myelin it's
Myelin, yes, like this, right? Myelin, right? Yes.
yeah,
Okay,
and because of that inflammation the myelin become gets destroyed, and that's why the interconnection between neurons it's affected
great. Yes,
and it's unstoppable. It gets multiple consequences in the body, principal motor in the motor system.
great.
It's correct, and that in
Okay, so you must have read. Well, first, let me clarify your doubts that you didn't, you weren't sure about some terms, right? Like you asked for lymphocytes, right? It's written this way, okay? Lymphocytes, and you were talking about B lymphocytes, so it's this way, okay? B lymphocytes. However, in English, you refer to this kind of cells more usual. I mean, this is the correct way, B lymphocytes, okay?
Mhm.
However, when we're talking in a casual manner, we just call them B cells,
Okay.
okay? So
Mhm.
the way you said it is the correct way, lymphocytes, and this is the correct way of writing them, B lymphocytes. However, we refer to more informal in a more informal way as B cells. Okay, so you told me it's a disease that mainly affects the central nervous system, right? So
Mhm.
this is sorry, central nervous system, and also the peripheral. I mean, sorry, yeah, that way. So and it affects actually the axons, right, between two neurons. So,
Yes.
so our nerves are made of axons, right?
Yeah.
So it also affects the peripheral nervous system. Okay, those terms you can use. Actually, you're going to see a lot of patients with this kind of diseases, right? So the central nervous system and the peripheral nervous system are affected. So this person might get to have weakness, right?
Yes, in the muscles.
Great, yes. So weakness, and what else would this person have? I mean, it affects mainly the motor part of the nervous system. However, it also affects the sensitive part of nervous system, right? So what would else this patient have?
Mm. I really don't know.
Okay.
If
I mean, it also could affect when we when we talk again about the motor part, which is more affected in this kind of diseases, right? Here it also affects the optic nerve. Did you read anything about this?
yes, no, I remember.
Okay. It also affects the optic nerve. Okay, so it causes. Oh, sorry. Diplopia. Just like in Spanish, diplopia, like double vision. Okay, it also causes when the optic nerve is inflamed, it causes optic neuritis. Sorry, optic neuritis. Okay, so this person has like a blurry vision. Do you know that term?
Blurry.
Blurry. I'm writing it down for you to understand. Okay, blurry vision is like visión borrosa. Okay, due to the inflammation of this nerve, which is the second cranial nerve, I think. No, yes, it's the second one, right? Because the first one is the olfactory nerve. Okay, what else would this patient have? Actually, it affects more men than women. Did you read anything about it?
Yes.
And what is it related to some kind of temperature? When it goes off, it's like the patient is like healthy for some time, and it had one. Do you know anything about this expression? Burst.
I No, I remember you mentioned it before, but I don't really remember.
Okay, but did you ever read in any part of any book or in the street this word, burst?
Yeah.
When you were
Well,
walking down the street, did you ever notice this word?
no.
Okay, where are you? I mean, you're in Bolivia?
Yes.
Okay, there's actually you're in Cochabamba, I guess, right?
No, I'm in La Paz.
So I don't think you did not see this word. I mean, there's at Multicine, I think. Yes, not Multicine. You went to Multicine, right?
Yeah.
There are some ice creams called Burst. You
I
didn't read that?
know. Yes, but I've never paid attention to that name.
Okay, that is that is the word. Okay, it in Spanish it means brote. Okay, brote. So a person with this disease is kind of healthy. You look at this person is healthy and then has a burst. So this person does not always have the symptoms. It's like healthy and then has one burst and has all the symptoms. Then he or she goes back to normal and lives his or her life in a normal way, and then has another burst, which is like more serious one. Okay,
Mm.
so this is a characteristic of this disease of multiple sclerosis. It shows up in bursts. Okay.
Mm.
So anything else you would like to talk about related to this disease? Anything you read about?
No, you mentioned that.
Okay.
Well, yes, it's okay.
Yes. Are you sure you were about to tell me something?
No, you already say.
Okay, so we got 2 minutes left. Do you have any doubts about anything that we talked about yesterday?
Not really.
You're okay with the pronunciation?
Yes, everything's okay.
Okay, Mariana. So remember, you have to join back to the meeting at the end of the class, okay? So we can have the poll or survey that we have every day. However, I'm going to write to the WhatsApp group to tell everyone to join back in, okay?
Okay, thank you.
Okay, so I'll see you later. Bye.
Bye bye. Thank you.
Thank you. Paul, are you here? Hello, Paola, are you there? Hey, Paula, how are you doing?
Hello.
Hey, so let's start, okay? So yesterday we were talking about medical stuff, right?
Yes.
And we talked about some specialties yesterday and the corresponding specialist to each specialty. So I got some specialists here in my slides, and well, they are all mixed up. There's no a single order for all of them, so it's all about luck. You got urology, okay?
Okay.
So could you tell me the name of the professional related to urology?
Uro urologist.
Great, urologist. So could you tell me a little bit about what a urologist does?
Um. Urologists now it's all about the urinary system.
The urinary system, yes.
Yes.
Notice pronunciation here, urinary system. Okay,
Urinary. Okay.
okay. So is there any disease that you might know of related to urology?
Something relational with kidneys.
Okay, like what kind of disease, any condition that you might remember now?
Kidney stone.
Sorry, didn't catch it.
Ki kidney stones.
Kidney stones.
Yes.
Okay. Like this, right?
Right.
They're also called calculi. Okay, calculi.
Mhm.
So, what kind of symptoms or signs would be related to this disease?
Mm, um, well, kidney stones are hard deposits made of minerals and salts that are inside our kidneys, right?
Yes, great. What kind of
Um,
components might they have? There's one main component of kidney stones. I mean, there are a lot of them, but most of them are, I think it's around 80% are made of one component.
uh, the symptoms and the signs, or what?
Okay, tell me about the symptoms and signs.
I know that a kidney stone usually will not cause symptoms until it's moved around within your or kidney or passes into or ureters.
Okay, so what kind of symptoms would this person have?
Pain or burning sensations while urinating.
Great. That is called?
Mm, I don't know. I'm just remember the symptom.
Okay, and in Spanish, what would you call that symptom?
Um, I'm second year of medicine, and
Ah,
the
okay,
theory, I'm not.
okay, great. Don't worry about it.
Okay, thank you.
It would be dysuria, right?
Ah, okay.
Okay, in English, it's written almost the same way, like this. Okay, like a sensation of burdening during the urinating process, right? And what I asked you also is, well, you told me it's they are made of some components like minerals, right? And I think, if I am not mistaken, around 80% of all the kidney stones are related to calcium. Okay, so most of them are made of calcium. So about symptoms and signs, anything else you would like to add? Like, there's something that is blocking, right? The urinary system, and what would that cause? You can tell me, you can explain it, and we will give the term in medical words to write it down.
Other symptoms.
Yes, or signs. Yeah.
Um, nausea. I don't know the next
Nausea.
word. Ah,
It would be nausea. Okay.
nausea. Okay,
Yes,
nausea.
nausea. And it is written just like in Spanish. Okay, nausea
Oh,
and vomiting.
yes, yes.
So, sorry, vomiting. There's a phrasal verb that we talked about related to vomiting. Do you remember what it was?
Um, I won't remember.
Let me give you a hint.
Okay.
What about that? You can see the screen, right?
Yes.
So here I have one part of the phrasal verb, THRO.
Um,
What's missing here?
throw,
Throw.
throwing. Uh-huh. Uh, throw. Throwing?
Throw up. Okay.
Throw up.
Yes.
Throwing up.
Yes. When a person throws up, is vomiting.
Okay.
Okay. Yes. So any other symptom or sign that you could find it related to kidney stones?
Fever?
I think, well, there are, as I was telling you, 80% of the kidney stones are made of calcium. However, there's a certain component that is related to kidney stones when they get infected. When they do get infected, yes, there would be fever,
Okay.
right? However, it is not usual. It is not that common. So as I was telling you, you have this kidney stone, and it goes to the urethra, right? And it's like it blocks the passage of urine. And since it is, let's say it has a certain size, and it damages the wall of the urinary ducts. So, as any kind of wound, we have blood, right? And
Blood in urine.
yes, great. And how do you know the term of that? Hematuria.
Yes, me too.
Yes. So, do you know how to make the difference between this sign from a bleeding in the kidney and how it would be different from the bleeding from the urinary ducts?
No, I don't know the difference.
Okay.
I hope the difference the other year.
Okay. So, do you want me to tell you, or do you want to investigate a little?
I want to investigate.
Okay. I'm going to tell you in Spanish, okay?
Okay.
La diferencia es una se llama hematuria glomerular y hematuria no glomerular. Para eso se pide un examen que es morfología de glóbulos rojos en orina. Okay, so you're going to read about that test, morfología de glóbulos rojos en orina, to make the difference between the bleeding from the kidney and the bleeding from the urinary ducts, from the lower urinary ducts. Okay? And you're going to tell me tomorrow. You all have homework.
Okay, thank you.
Okay, so there also would be flank pain. You remember when we were talking about the quadrants of the abdomen? There was the right quadrant and the left quadrant. We have pain in those quadrants, okay? It is actually, and in Spanish, is called, well, it has a certain name to describe that pain, that kind of pain. So in physical examination, this person, how would you find this patient? Here's an expression that we might not have talked about. Is, do you know this word right here? Sword.
I never heard this name.
Okay, I'm going to say it in Spanish for you to understand, okay?
Okay.
A person who is sore is adolorida, right? The main symptom here, we're talking about symptoms, is pain. So this person is sore.
Sorry.
Yes, well, there's something that I read that I found interesting. In men who usually have this kind of diseases, well, this kind of disease, it's the equivalent to given to birth. So it's quite painful. Okay, so this person is really sore.
Okay, yes.
Okay, so what else would you find in physical examination, during physical examination?
And many in many occasions the people have kidney stones that have kidney stones, have fever, or increased heart rate and respiratory rate.
Yes, that is related to pain, right?
Yes,
Yes, so
the
this is,
reaction is that.
yes, great. So this person has tachycardia.
Mhm.
Sorry, I missed. Okay, so this person has tachycardia. Okay, great.
Uh-huh.
What else you were saying?
Increase the respiratory rate.
Great.
Ah, uh-huh.
Okay. I think that would be it, right? During physical examination. And what would you ask for when you want to investigate with the complementary studies?
I want to ask
Okay.
if the disease is only more in women or boys or old or all year.
Okay, they are, well, this disease is related more to the male sex, okay? So
Okay.
it's more like in men. Okay, so in complementary studies, we would ask for a urine test. And there we have the report from the lab about the crystals, right? You told me the minerals are related, right? So crystals, okay? So that there we have a report from the laboratory, and we have like a clue about what these kidney stones are made of, okay? What else would you ask for?
Mm, uh, I think that drink water.
As treatment, right?
Yes. Oh.
Yes, it could be, yes. However, sorry. Uh, well, do you know the meaning of complementary studies for the diagnosis?
I don't even.
Okay, a complementary study is some kind of study that would help
Ah.
you to get to a diagnosis. So here we have the urine test, right? To know if there is, if the lab personnel can find any kind of crystals related to what this kidney stone is made of. Usually, as I told you, calcium, right? So is there any other test that you might ask for?
I don't know, surgery, but this is super extreme.
Yes, it wouldn't be the first option, right?
Yes.
However, in complementary studies, we would ask for an ultrasonography,
Oh,
right? What is an ultrasonography in Spanish?
what is another fear?
However, we don't call it that way, right? We would call it
Yes.
ecografía, right?
Oh, yes.
Yeah, that would be, well, I think, well, there are some other tests, and you already have,
The urethoscopy,
sorry?
endoscopy, endoscopy.
Okay, yes, endoscopy, right? And
Yes.
there's a treatment, I don't know if you heard about, in which mm, uh, it's not invasive at all. I mean, we do not have to enter the body so we can give treatment. It is shock waves. Did you ever read about shock waves? This one? Did you ever read about this? Shock waves?
No.
Okay. This is part of the treatment, okay? Uh, by tomorrow, you're going to read a little bit about this, and you're going to tell me what this is used for and how it works, okay?
Okay.
Okay, so we got our 15 minutes, Paola. So remember, you have to join at the end of the class to, well, when I show up the poll or survey, okay?
Okay. Thank you.
Okay, see you later. Valeria, are you there? Valeria Guerra? Hello, Valeria, how are you doing?
Hi, good night. Fine, and you?
I'm fine, thanks for asking.
I
So,
wanted to ask you a favor. Can I be the last one? I'm driving home right now.
you're driving your car?
Yes.
And
I thought that I was going to pass around 7:15. So, but I'm like 15 minutes away. So, you said that the Nixa, or I don't remember who, will take around 30 minutes, right?
yes, so you would go after this person?
Yes.
It would be in half an hour, more or less.
Yeah, it's fine. I will be in the meeting.
Okay, so I'll see you in a while, okay?
Okay, thank you.
Okay, you're welcome, bye.
Bye.
Danitza Burgoa, are you here? Danitza, are you here? Hello, Danitza? Danitza, are you here?
Yes.
Okay, Danitza, so there's only the two of us, okay? Yeah, I just talked to Valeria, and she told me she was driving her car. She was on her way home. So she told me there wouldn't be a problem if she's the last one, because well, it's going to take a while for her to get home. So we're going to start, well, with you, okay?
Okay.
Okay, Danitza. So yesterday we were talking about some specialties, right? Related to medical stuff. So I got some specialties. I got some specialties right here in my slides, and they're all mixed up. There's not a single order for all of them. So you got the next one, which is the gynecology. Okay. So could you tell me the name of the specialist related to gynecology?
Gynecologist.
Great. Actually, it's gynecology and obstetrics, right? And how would
Okay.
you call, how would you use the word obstetrics to give a name to the person?
Mm,
Can you repeat the question, please?
Okay, so here we are talking about gynecology and obstetrics, right? You told me that the person is a gynecologist, right?
Yes.
Okay, and what about the other word in gynecology and obstetrics? How would you call this person who, well, related to obstetrics? You already told me gynecologist with gynecology. What about obstetrics?
Obstetrist. Um, obstetricist. I'm not much sure.
Okay, I'm going to write it down, okay? You were right about the first one. It's a gynecologist. However, there's another word, right? Here, gynecology and, sorry, yes, sorry, and like this, right? And obstetrics. However, here we have the word that you told me, which is correct, and the word to refer to a person who practices obstetrics is an obstetrician. Okay.
Obstetrician. Yes.
Okay, so it would be gynecologist, obstetrician. Okay, so could you please tell me what gynecology does? What his or her role is?
The role of a gynecologist is to diagnose, to treat the female reproductive
System, right?
system. Yes.
And
Illnesses.
yes, great. And what about an obstetrician?
The obstetrician is the specialist who's is, it's in charge of the I don't know how to say it correctly. It's about the pregnancy.
Great. Okay, great. So basically, a gynecologist is in charge of non-pregnant women, and an obstetrician is in charge of pregnant women, right?
Yes.
Okay, great. So do you know any disease about gynecology or obstetrics that you might like to talk about?
It can be ovarian cysts.
Okay, ovarian
I don't know.
cyst. Yes, I'm going to write your name down. You are Danita Burgoa, right?
Yes.
Okay, and you cyst. Oh, sorry. Ovarian cysts. Like this, right?
Yes.
Okay, what do you know about this disease?
Well, actually, I was talking about this disease. I think, well, in Spanish, it has a different name. I don't know how to say it in English. It is, in Spanish, es el síndrome de ovario poliquístico.
Great, yes. And
Oh,
what would you, yes, could you tell me a little bit about this disease? I mean, did you ever read about this disease?
well, actually, this syndrome is a hormonal disorder
Yes,
in
great.
that in women of reproductive age.
Great.
That these women have mm, irregular or prolonged menstrual cycles.
Great. Awesome.
Period.
Yes. So what would you call that as a sign?
Um, well, it can appear with mm, um, like in it's like I said, a hormonal disorder that can appear with another signs that cannot be like from can for example it can appear with acne. I don't know how to say it in Spanish.
Yes.
In English, I'm sorry. Acne.
Yes. Great.
Um,
Okay, so you told me it's related to irregular cycles, right? Menstrual cycles. So what would that, there's a word for that, that sign actually. Do you know this word? I'm going to write it in Spanish, okay? What does this word mean? Do you know?
is in Spanish.
Could you, you already told me in English, you already told me. Irregular menstrual cycles is related to this word, okay? In English, we would add an H between the R and the A, and it's called metrorrhagia, okay? So this is related to, well, this actually means irregular menstrual cycles, okay? And what about this word? Did you ever read about this word, menometrorragia, in Spanish?
Not real.
Okay, so this one, the word above the last one that I wrote, so this one is referred to irregular cycles, right? And when you add this part, meno, to the last part, sorry, when you add and put them together, it means irregular cycles and like a lot of bleeding.
There's
Okay.
a lot of bleeding.
Yes, there's a lot of bleeding, and the cycles are irregular. So when we add an H here, we got the words in English, menometrorrhagia. Okay, it means irregular cycles and with a lot of bleeding. Okay, so the one related to this disease is actually this one, right? Metrorrhagia. So you also told me acne, right? And that is correct. And why do these people have this clinical manifestation, this feature?
Mm, I really I can't explain. Um,
Okay.
there's a
Yes.
hormonal disorder, but I really can't remember where exactly.
Okay. So this disease is actually related to an increased level of testosterone. Okay.
Oh yes, yes. Excuse me. It's a this disease also causes in Spanish hirsutismo
Great. So
as
it's written this way, hirsutism. Okay.
hirsutism. Okay.
Okay, so both acne and hirsutism are related because there's a lot of testosterone in the bloodstream. Okay, acne and hirsutism are related to high testosterone levels instead of estradiol, right, which is an estrogen. Could you tell me the three main estrogens a woman has all along her life? Danita, are you here? Hello? Danita, are you still here?
I'm sorry, doctor. I thought I had the microphone on.
Okay, don't worry. I mean, don't be shy. I mean, I'm not going to. Do I sound like a bad guy or something?
No,
you,
I'm just
you, you're kind of shy, right?
yes,
Okay, don't be. I mean,
okay.
we all make mistakes, and that's why we're here because we do not know everything. Okay, so anything you
Yes.
would like to add about this disease?
You asked for the three main estrogens
Oh yeah,
in females, right?
yes,
Well, yes, it's estrone,
yes, great.
estradiol,
Estradiol, yes,
and estriol.
great. And which one of those estrogens is increased in this disease?
The okay. No, I don't remember.
Don't remember. Okay, usually during this period of years in which this person is well has the opportunity to reproduce, right? Normally, the estradiol is the main one. However, when a person has this kind of disease, actually this disease, uh, this one, uh, and I'm going to write it in Spanish. Okay, this one is higher than the others. Okay, estrona. So, what about physical examination? What would we find in a patient who has this diagnosis of ovarian cysts?
Well, we will see. Um, the patient will refer maybe pain in their periods. This
Okay,
menorrhea. We
okay,
can see also um, at what we can see that she has acne, hirsutism. Also, she can have overweight.
Great. Yes. So this person would be overweight. Uh, right, overweight. You also told me that this person would have acne, and it would be related to greasy skin,
Greasy skin.
right? Greasy skin. Also, erysitism. Do you know the difference between erysitism and, well, there's another word. I don't really remember, but okay. Anything else about physical examination? You were you're doing great.
Also, the patient can have certain areas in the skin, and I don't know how to say it. But I remember that read I read about it. Certain like dark zones at the
Oh,
body.
yes, that is related to insulin resistance,
Yes,
right?
yes, this patient has that problem with the insulin too.
Great. Yes. So signs of insulin resistance. So signs. Great. Yes, you are giving me more than I expected, actually. So great. So any
Thank
complementary studies that you might ask for?
well, I I ultrasonography.
Great. We in English
Okay.
we don't call it echography, right? We call it
Yeah.
ultrasonography. Yes, ultrasonography. Great, awesome. That would be the first one, actually, right? We
Yes.
suspect of this disease. Any other that you might think of?
I would like to see the levels of the insulin. Like I will ask
Awesome.
for a blood test. Um,
So,
química sanguínea. I don't know how to say it.
okay, blood chemics.
Yes.
However, we can focus on glucose,
Also,
right? Glucose levels. And anything else you might ask for?
maybe a pregnancy test. But
Great. Yes, actually, this disease is its first differential diagnosis is pregnancy, right? Yes, so you are right. Actually, right, before ultrasonography, we should ask for a pregnancy test. Yes, pregnancy test. Awesome. You want to be a gynecologist?
oh no, I
But
don't like the babies. Well,
really, because you know
I
a lot of features about this kind of patients. Yes. Anything else about laboratory, maybe?
maybe I can ask for thyroid, no, thyroid hormones.
From
Thyroid,
thyroid, right? Yes, great.
thyroid.
Great hormones, right? Oh, sorry. Awesome. And anything related to this, to acne and erysitism?
Um, uh, and yes, a hormone test of testosterone.
Awesome. Great. So here we have a lot of studies that we might use, right, to help us with our diagnosis. So great, you did great. And I think we might know, is there any doubt about pronunciation, about this last topic that we talked about, or the last practice that you actually missed?
Yes, doctor. I wanted to know about the other practice that I missed. Can I have? I would. Can you tell me, please, what can I do, or
Do you
what
have,
we're gonna do?
okay, I'm going to open the other document, which is this part, yeah. So is there any doubt about, you see the slides? Do you see the slides? Parts of the body and their functions or not?
Yes, I
Uh,
see.
okay, I'm going to share. Now, can you see it? Parts of the body and their functions?
Yes.
Okay, do you have any doubt about pronunciation here? Could you read
Like
this for me? This one?
superior vena cava.
Awesome. Yes. A lot of people had some problems with pronunciation with this term. What about this one?
Right atrium.
Great. And this one?
Um, tricuspid bulb. Tricuspid.
Yes, that last one, tricuspid. And this one?
Mitral bulb.
I don't know why you are so shy because you did all right. Okay, so what about
Um,
this one? Do you know what this term is used for? I mean, what does it mean?
yes, I answered that question in class. It is also known as.
Why are you so shy? You get all right answers. Okay, so any question about pronunciation here?
Um, oh yes, about the layers of, no, the types of the pericardium.
Okay,
I don't know how to say.
okay, the
Serous.
layer. This one?
The yes. I don't know how to say serous or fibrous.
Yes, you pronounce them correctly. Okay.
Serous.
This word comes from serum, right? So it's serous, and this word fibrous comes from fiber, right? So it's fibrous, right? Okay. So could you? Well, a lot of people also had problems with this word. Could you read it for me?
Parietal.
It's actually parietal.
Parietal. Okay,
Okay.
thank you.
Okay. What about this one? I don't think there's. Is there any doubt?
No.
Okay. Could you read this word for me? This whole word.
Deoxygenated.
Awesome. This one. I mean the whole term. All this.
Coronary sinus.
Great. Why are you so shy? You have great pronunciation.
Thank you, doctor.
Okay, so here do you remember this one?
Cordia tendinea.
Great. Uh, this one's easy. Could you tell me this molecule?
Hemoglobin.
Hemoglobin.
Yes.
Okay,
Hemoglobin.
great. Do you have any doubts here? I mean, it's easy, right? This one's easy. Do you have, if there's any doubt about the words that you get to read here in any slide, you can tell me. Is there any doubt here?
That word arterialize, is that correct?
Yes, awesome. I don't think there's doubt here, right? What about this one?
Nope.
Awesome. Some people had some troubles with this word. Could you read it?
Determines.
It's actually determines, okay?
Oh,
Because the base form of
determines.
the word, of the verb, is to determine, okay? To determine.
Yes.
And when we're talking in third person, which here would be heart failure, and here we add an S at the end of the word, it's actually determines, okay?
Determines. Okay, thank you.
Okay, so what about this one?
Which one? I can't see it.
I'm sharing my screen. You don't get to see it?
Um, the old slide, or which part I can?
What about here? Do you see any slide? Female reproductive system?
Yes.
Okay, is there any doubt here about pronunciation?
The fimbria. Fim,
Yes, you're doing great. It's fimbria, as if the E didn't exist, okay? Fimbria.
okay.
Anything else here?
No,
Okay,
I guess.
what about this one?
Oh, I think all of it.
Really? Could you read this for
Well,
me?
hypothalamus.
Great. And this word, some people had some problems with this word also.
Yes, yes. Um,
It,
mm,
luteinizing hormone, okay?
luteinizing
Yes.
hormone.
Okay, any other that you might have problems with here?
Luteinizing.
Yes,
That's what you said, right?
yes, luteinizing.
Okay.
Okay, any other?
Mm, anterior pituitary.
Yes, great.
Um, yeah. Okay.
Okay. That's one. Here's a lot of structures. Do you have any problem with pronunciation with any of them?
Um, jejunum.
Yes, it's great.
Yes, I think that's it.
Okay. Uh,
Thank you.
some people had some problems with this one also.
Nasopharynx.
Okay, it actually would be a nasopharynx, okay?
Nasal.
Yes,
Okay.
because nasal comes from nasal cavity, right? Nasal cavity, nasopharynx, okay? And so any other here?
Nope.
Okay. How would you read this word? I'm sure you're going to do great.
Dysphagia.
Awesome. Great. You have great pronunciation. Any other
Thank
word here?
How I said, hydrochloric acid.
Yes. Great. Hydrochloric acid. Any other?
Parietal, parietal cells.
Yes. Great. What about this one? I mean, when we had this practice class, we all focused on pronunciation, right? Because they are all structures. So I see you have good pronunciation. You do not have problems with it. So is there any here?
The H2 inhibitor.
It would be
I'm not sure.
inhibitor. Inhibitor.
Inhibitor.
Yes.
Inhibitor. Okay.
Okay. Okay. Any word here that you might find difficult to read or have problems with pronunciation?
No.
Okay. This is easy. What about this one? How would you read this?
Pneumocyte.
Great.
Yeah.
Yes, correct. Yes. Okay. Any other any word here that you might have some doubts about?
It's a Malpighi or Malpighi pyramids.
It's pyramids.
Pyramids. Okay.
Pyramids. Yeah. Okay. Malpighi
Pyramids.
pyramids. Yeah. Any other one?
Hilum. Renal hilum.
Yes. Great. Highland. Yes.
Hilum.
I think the rest is fine, right? Here. Is there any doubt about any of these slides? This one, how would you read this word?
Convoluted. Convoluted.
Yes, convoluted. You said it. Great. In Spanish, it's the, well, we would call it contorneado, right?
Sí. Yes.
Okay. You have all the pronunciation correct. You have great pronunciation, as I told you. We basically focused on pronunciation of the structures. I see you do not have any problems with it. So you got your practice from today and from Thursday, I guess. Yes. Okay.
Thank you, doctor. Thank
You're
you so
welcome.
much.
You're welcome. So there's only one of your classmates left. And right after that, please join back the meeting so we can have the poll or survey. And right after that, we're done, okay?
So you're gonna send a message?
Yes, I'm going to write to the
To-
WhatsApp group so you can join back and we have the poll and that will be it, okay?
Okay.
Okay, thank you. Talk to you later.
Okay.
Okay,
Doctor.
bye.
Bye.
Valeria, are you here? Valeria Guerra, are you here? Hello, Valeria.
Hi, how are you?
I'm fine, thanks. How are you? You got home. You're done driving, right?
Yeah, I'm not driving right now, but my mom is driving, but I'm like 2 minutes away from my home, but it's fine. I'm not driving.
Okay, you have to drive safely, right?
No, yeah, sure.
Okay. Okay. So
It's a pop out that it says break rooms will close in 50 seconds.
okay. Give me a minute here. I was talking
I
to
think you
your.
need to add more time. Hello?
Add more time too.
To the break room, or I'm the last one.
You're the last one. Yes.
Porque me dice que me voy a salir, me va a sacar como de la break, me va a pasar como la main room.
Really?
It's a pop out that says break room will close in 20 seconds. O sea, it's like a countdown.
Oh, really? Do you know how can I fix this problem?
No, porque that, o sea, you set up from the beginning
Uh,
the time for the break room. So maybe. Hi. Hi. Hello.
hello, are you there?
Yes,
Okay, I
we're in
think
the main room, but
yes.
is the
There's only just the two of us right now, right?
Mm-hmm.
So, do you think we can go on here? And
Yeah, sure.
right after that, I'll tell the others to join back in, and we'll get the poll, and that will be it.
Okay, yeah, it's fine.
Okay, so let me share my screen. Okay, so you see my screen, right?
Yes.
Okay, so yesterday we were talking about some specialties, right?
Mm-hmm.
And I chose some specialties and wrote it down on my slides, and they're all mixed up. And by luck, you got gastroenterology. So please tell me what the specialist would be called related to gastroenterology.
Hola. Hi. What?
Uh,
Yes. What is the specialty?
the specialist, the person related to this
Uh,
specialty.
Gastroenterologist.
Yes. So, could you tell me a little bit about what this specialty is all about?
Yes, they treat problems or disease related to the digestive system.
Awesome. Great. So, could you tell me any kind of disease that would be related to this specialty?
Hep, I don't know how to pronounce it. Hepatitis.
Hepatitis.
Hep, hepat, what? I'm sorry.
Yes, hepatitis.
Hepatitis.
Okay. So, could you tell me any symptoms and signs when a patient that you might be treating would have?
With hepatitis.
Yes.
Let's see, like which hepatitis
Or signs, also signs.
signs. Okay, signs may be nauseous, fever.
Great, since most of the cases are related to infectious disease, right?
Yes,
So yes,
like
it
dark
would.
urine.
How would you say in English the yellowish skin in English?
What do you mean? What's called the disease?
No, there's a sign in which the
Uh,
ictericia in English.
uh, in which hepatitis or what?
Yes, I mean when a
See.
person has hepatitis, uh, his or her skin and scleras turn yellow, right?
Okay. A.
How would you call that in English? How would you call that sign?
Jaundice or I don't know.
Yeah, you got the word. It's jaundice, okay?
Jaundice. Okay, jaundice.
Okay, so it's written this way. So you also said
Jaundice.
nausea, right?
Yes.
And you also said, well, nausea and
Fever.
vomiting.
Vomiting, fever.
Awesome. Also, what else would this person have?
Abdominal pain.
Great. Awesome.
John, what was the pronunciation?
Jaundice. It's
Jaundice.
like close to an O. A and U,
Jaundice.
like an O, close to an O, right? It would be
Mhm.
jaundice. Okay. So abdominal pain, well, I think most of them are already written here. And what about physical examination when you have patient with hepatitis? What would you find as if you were a doctor checking on a patient with this disease?
Rash.
Okay,
Or-
yes, that would actually be a symptom, right? Or sign. But when you are checking on a patient during physical examination, what would this person have? What would you find?
Uh, I don't know. I don't know. Uh-huh.
Okay, so you said abdominal pain, right? So when
Yeah,
you
abdominal.
when you're checking on a patient, you get
Abdominal pain. Uh-huh.
in which quadrant of the abdomen?
Lower. No, I don't remember. But I don't know how to. In which. I don't remember the quadrants.
Okay, so there's two
In
nomenclatures,
we
right?
know. Huh?
There are two nomenclatures, right? And the most commonly used by US doctors it would be like the right upper quadrant.
Right and upper quadrant.
Right upper quadrant, right? Okay, so there would be pain here, right? Located here. Anything else you would find during physical examination?
But a fever is not an fever.
Yes, you could also
Yes.
during physical examination you could also find fever. Yes.
Okay.
Okay. Anything else you might think of?
The skin, the color of the skin, all right?
Great. So we call that jaundice, right?
Jaundice.
Okay. So any complementary study that you might ask for as a doctor, of course.
How or what should I ask? What
Yes.
could I ask to the patient?
No. What kind of studies would you ask for? What kind of studies would you use to get to a diagnosis?
Bueno, blood test.
Yes. Okay.
I think is one for the hepatitis.
The antigens, right? The core antigens, and well, there are several others. So here we have the antigens, antigens, especially the core one, core antigen, right? You read about it, right?
Yeah, antigen. Yes. And
Okay,
or
anything else? The antigens, especially the core
no.
antigen. What about any imaging test?
The red no, it's not red. I don't know, se me traba la lengua. Em, radiografía, no.
Not really.
No sé,
That
oh my God.
that would actually be an X-ray, right? But in this case,
X-ray,
we would not actually ask for an X-ray. It would be
See
actually
something.
it could be, yeah, but it's not that useful. It's much more useful an ultrasonography.
Ultrasonography,
In Spanish,
ultrasonography.
in Spanish, how would you call this test?
Ultrasonografía.
Do you call it that way in your country? It's not usually known as ecografía.
Hay no, ultrasonografía abdominal o eco, puede ser eco. Sí, también puede ser.
Well, they're the same
Either
thing,
way.
right? Yeah. Okay. Anything else you might ask for in a patient with this disease?
I don't know. I don't know.
It
What
would be useful also.
elementary study.
It would also be useful a urine test.
Urine test.
Yes. What about blood test? Besides antigen, is there anything you might focus on? Anything else you might focus on when we're talking about blood tests?
Maybe the creatinine.
Maybe, but more
Oh, no.
related to the liver, because we're talking about hepatitis here.
I don't know which one.
Okay, that is your homework for tomorrow. Okay, you're going to investigate a little and tell me tomorrow. All of you have some homework to do. Okay. So I see you do not have problems with pronunciation. You have good expression. You're doing great. So I think we would be done by now. And let's call all the others to join us. Okay. Do you have any doubts before we leave?
Yeah. Maybe a favorite. I wrote to Allison yesterday and I sent a voice note, but maybe you can talk to her that I'm having a little bit trouble to continue with to the next model because I have an emergency flight on January on the 6th and it's around 20 days. So I can try to connect to the class, but it's a little town in the US in Washington. So maybe I don't know if I will have everyday Wi-Fi.
Okay, don't worry about it.
I know.
Okay,
so maybe if I finish this. Okay.
Okay, actually, that is more like you should talk to Allison. However, because when this kind of problems turn up, well, she tells me what to do, right? Because it's up to her, actually.
So maybe you can.
Okay, I'm going to talk to her about this case, about your case, and see what she tells me, okay? So don't worry about it, I will talk to her. Okay, so I'm going to ask your classmates to join us, okay? So we can get this over with.
Okay.
Hello, guys. So only 4 of you joined the meeting. So we're going to wait for the others to join. And we have the survey or poll, and that would be it. So let's wait for the rest of you, okay? Okay, guys, I think there's only 7 of you who joined the meeting. One person asked for permission to not join this last part of the meeting because this person was busy with some sort of test. So let's get started with the survey or poll. And here it goes. Let me know when you're done.
I'm done.
Me too. I already finished.
Me too.
Okay, guys. So that would be it. Thank you for joining back the meeting. And well, I'll see you tomorrow, and we'll get started with some diseases, okay? And we will talk about them a little more deeply. So have a good night's sleep and see you tomorrow.
See you tomorrow.
Good night.
Good
Okay.
night.
Okay, good night. Bye.
Bye.